Jean Watson's Theory of Human Caring by Norma Alberon Duarte, California State University, Dominguez Hills School of Nursing, Advanced Nursing Roles. When nurses use a theoretical approach for their practices, it helps them use their found information and to progress through the nursing process in an organized manner which improves the quality of the patient's care. I chose to apply Jean Watson's theory of human caring as it can be applied in the role of the nurse educator. Watson's values and assumptions. The Jean Watson's theory of human caring was developed to help nurses express care to their patients. Caring is central to nursing practice, and it promotes more than just a cure, but promotes health. Watson believes in a holistic approach when practicing care in nursing. The values of Jean Watson's theory involve human caring. According to Watson, human caring is based on human values such as kindness, concern, and love of self and others. For assumptions, Jean Watson posited that curing disease is the domain of medicine, while caring is the domain of nursing. She proposed 7 assumptions about the science of caring. Caring is interpersonal, consists of character factors, promotes health and growth, accepts the patient, has a caring environment, is the science of caring and curing, and is the practice of caring. From these assumptions, Watson developed a theory based on curative factors that allow the nurse to deliver integrated healthogenic care. There are 10 curative factors that have evolved towards the clinical curitas processes. As her theory evolved, it allowed translation of the original curative factors into clinical curitas processes, suggesting more open ways in which they can be considered. Curitas comes from the Greek word meaning to cherish, appreciate, give special attention, if not loving attention to. It connotes that something is very fine, that indeed it is precious. Curitas is a term that characterizes how nurses may choose to approach their patients and colleagues. Empiricist paradigm influence. Empiricism understands objective reality that grounds modern science. From this perspective, what is true is what we can experience and measure with our 5 senses. Since senses are used to verify reality, the preferred method to collect data is by observation. In Watson, she believes in the systematic use of the scientific problem-solving method for decision-making. This falls under one of her character factors, although a theorist whose domain includes spirituality and the soul. Watson is also strongly grounded in empiricism. She emphasizes the importance of using logical and scientific thinking to understand and respond to clients' needs. Evolving towards curitas processes, this is to further explain the problem solving through the curitas process. It is the full use of self and artistry of caring healing practices through the use of all ways of knowing, being, doing, and becoming. Watson's interpretive paradigm. Interpretive paradigm involves a patient as a whole, is patient-centered and subjective. The focus is on the human experience, therefore subjectivity rather than objectivity is emphasized. When little is known about a patient, qualitative methods are helpful in recognizing patterns of experiences and the relationships between them. Interpretive paradigm is applied to Watson's theory. She focuses on 3 major elements: the curitas factors, transpersonal caring relationship, and caring occasion, caring moment. Watson's curative factors seek to honor the human dimensions of nursing work and the inner life world and subjective experiences of the people we serve. 2 examples under curitas factors are developing and sustaining a helping, trusting, authentic, caring relationship, and being present to supportive of the expression of positive and negative feelings as a connection with deeper spirit of self and the one being cared for. The second element, the transpersonal caring relationship, describes the nurse's caring consciousness and oral commitment to make an intentional connection with the patient. The third element, caring occasion, caring moment, is the space and time where the patient and nurse come together in a manner for caring to occur. Watson's theory applied to the nurse educator role. In the United States, obesity is a major health problem among children. Children between 2 to 19 years of age are either overweight or obese. Cholecystectomies in children are more common in Hispanic children and the severely obese pediatric population. If a cholecystectomy has taken place or cholelithiasis due to the effects of obesity, empiricis comes in play when more information is needed to improve the care of the patient. In education, data produced by studies can help student nurses use the outcomes of the research into their practice. The scientific method is associated with empiricism. Senses are used to verify reality. Therefore, the preferred method to collect data is by observation. Nurse educators teach their students to apply knowledge learned from their research and studies. Applying empiricism involves physiological measures such as the patient's vital signs, viewing laboratory results, and imaging procedures. Even though the information is objective, the educator can teach their students that during these procedures, they are to maintain a healing environment that is a caring atmosphere, which will allow the patient to recover and develop to his or her full potential. They can hold their patient hand and make sure they are covered up during these procedures. Interpretive. In prevention of future gallstones, controlling childhood obesity will require team effort that include the individual, family, local communities, and national organizations. Nurses in general caring for their patients are also capable of teaching new behaviors and offer anticipatory guidance. Therefore, the educator is to teach their students and how to promote healthy lifestyles to patients and involve the family and child by using development-appropriate questions, making it subjective. By involving the patient in the care, emerges courageous factors and transpersonal caring. Educators can include transpersonal caring in their teaching as it potentiates comfort measures, pain control, sense of well-being, and spiritual transcendence of suffering. When I prep my patient prior to any procedure or topic, I ask the child, what do they know about the procedure? What fears does the child have? Do they understand what is going to happen while they are hospitalized and why certain tests are to be done? I reinforce that it is okay to cry, provide choice of pain modalities that are appropriate for their age. And finally, under caring occasion, caring moment, a caring occasion occurs when the nurse and another come together with their unique life histories and phenomenal fields in a human-to-human transaction. This is an opportunity for both the nurse and the patient to decide how to be in the moment and in the relationship during that moment. It may open up new possibilities for healing and human connection at a deeper level than physical interaction. The educator would encourage the students to empathize with their patients and to recognize themselves in their patients. This helps avoid reducing oneself or the patient to the moral status of being just an object. Watson's theory can be used in academic programs and educational settings. By utilizing the science of caring, it can help empower students to use their psychosocial skills. These are my references. Thank you.